What's up, everybody? We went to Squat University while we were in St. Louis and kind of took advantage of being there. I had a few issues that I've been really wanting to work with, been trying to work through them for the last couple of years. Really thrilled to have the opportunity to go to kind of the expert at squatting and kind of really go through this, assess some of my issues, and see what I can do to work through them. So I'll just give you a little rundown of things I've been dealing with. I have practically zero internal rotation in this foot, this hip rather, and then this one also has pretty poor rotation this way when it comes to just being tight overall in both sides of the capsule. Really tight adductors, really tight groin. So a lot of the issues I would deal with while squatting are, first of all, I'd get really tight pain in my hip flexors. So coming down here, I'd get to a certain depth, probably about here, where it'd just be daggers right in his hip flexors, hurt to go for it. So then from the side, I would really have to start tucking my lumbar spine to get to that depth point instead of creating a nice, decent spot there. Another issue I was having was this foot was really wanting to roll outwards. Every time I squat, this thing would just go poop, 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 poop. I'd start a set, pretty much here, finish the set out here. So that hip just has such little internal rotation in it that it's all going down to that foot and it's just trying to find it somewhere. So a lot of knee drifting, a lot of everything happening. So I couldn't get very symmetric, external rotation when you try to squat, toes on the ground, push out, boom. It was just really not equal on one side and the other. So really looking to fix that. Dr. Horschig put me through a lot of corrective exercises, gave me a lot of homework to do. It's been so much better since then. I'm really looking forward to going through those and continue to make it better. Even just sitting here doing these air squats like before would have been painful and not fun at all. So even just the fact I could sit here and do these without a warm up and without 30 minutes of stretching was a good.
About there's where you get that impingement. On the right side or both sides?
Kind of both.
Okay.
Yeah.
Gotcha. Okay, knees forward. There you go. Okay, make sure your hips square. Good. Okay, looking good. Okay, switch sides. Same thing on the other side. Stay square.
She was like so out of it.
Good.
And I'm like,
Okay, so side to side we're seeing pretty good symmetry. Okay, that's good. Very good. Looks pretty symmetrical. Very good. Okay, jump on up. Okay, so from here, and then drop down. Okay, now here's the big thing is that we're not just looking for a kin hit drop. Obviously, I'd like to see, what I'm looking for is symmetry. And I would say actually on this side, it's good. Maybe if you can be a little bit better on that side.
Yeah, no, it's weird. This is my left one's kind of historically has been my tighter of the two parts.
Yeah. Yeah, definitely tighter on this side. I mean, that's all you got.
I can barely cross the leg.
Okay, so again, we're going to keep that in mind because we're going to do a test retest and see stuff side. So next one, hip internal rotation. Okay, so just relax as much as possible. Okay, so here's your second thing. Okay, here, you're barely getting past neutral. Okay, so here's your second one. If I come up and like try to jam in, do you feel that pinching pain in the front side of the hip? Yeah. Okay. So that's number two thing that we're going to focus on. Now from here, pull this hip open. Very good. Do you feel like this slight, straighten this leg up, slight stretch deep within the hip joint? That's what I'm looking for. Okay. So again, breathe into the position, 5 deep breaths. And then all you're going to do once you're done with 5 deep breaths is just bring that hip back down to that neutral position for the RDL. Very good. If you get too much hamstring with this, just bend the knee a little bit more. Yeah. Very good. Straighten that back right now. Good. Does this feel okay?
Yeah.
Good. So we do 5 of these for 5 deep breaths in and out. Yes, I want you as far as you can. Yep. Okay, so from there, drive that knee in a little bit. Okay, do you feel like a little bit of a gapping right here?
Yeah, a little bit.
Okay, you got a little bit more motion. Okay, 3-second hold. You're just trying to relax that hip as much as possible. Then drive out to the side and squeeze this glute muscle right there. Does that feel okay? 3-second hold. You're actually pushing. So we're trying to externally rotate and squeeze that glute. So this is the neuromuscular re-education, basically teaching that glute how to create that external rotation torque. And then we also want it to be able to relax enough. We want to be able to gain some range of motion going in. So both of them will flexibly work together to make this the most effective. So a couple of deep breaths, relax that hip joint. And actually what you'll feel is when you just relax your hips and just let that tension go, you'll just notice you're going to be able to push in a little more hip exercise. So I want 10 of these total, and then we'll retest.
Much more.
Even more. Oh yeah. Now look at that. Okay. So there we are almost as equal. I mean, still you got a little bit more on this side, so we got some work to do. But that just shows how much more rotation you have out of this joint compared to last time. So the combination of the assisted conveyor plane and the band joint mobilization. Down to the ground, engage those hips, bring the hips up, and squeeze your glutes as hard as you can in this position. Okay?
I'm almost feeling more flexor.
Yep. I want you to drive through your toes a little bit more as if you're pushing the floor away.
On like this way a little bit.
Uh-huh. Okay, when you drive through your toes, you feel the glutes a little bit more?
Yeah.
Good. Now here's the deal. You have a 10-second hold. Okay?
Been about 13 already. Better 2 minutes.
Okay, and then back down. Okay, you have
down or down?
just to right there, and then back up again. Make sure that toe straight forward. Okay, so 10 for 10 seconds with the emphasis of pushing through your toes. Now, here's the science of it for you. When you push through your toes, you activate your quads a little bit more, okay? The quads reciprocally inhibit the hamstrings, so they turn them off because they can't do the same thing, right? Or else we don't get any joint movement. The only thing else to get your hips up is your glutes. So we use a little bit of science to be able to turn on the glutes a little bit more. Whereas sometimes if you were to just push through your heels, you'd probably get a lot of hamstring, which is, you know, for some people maybe what they're going after. But for right now, our goal is the glutes. Because the glutes are going to create that external rotation torque and that pull on the femur to center the hip side just a little bit better, which means less hip impingement. Does that make sense? It's a part of it. It's a part of it, yeah. So you are going to teach yourself how to maintain stability with the foot straight forward. So you're going to be in this position, get that knee out to the side a little bit, and then you're just straight hinging, small squat, tap the ground, and back up. And keep yourself from wanting to turn that toe out or lean to the side. It's going to be the toughest.
Just a little rotate.
Yep.
Trying to rotate out.
So slow squat, tap the ground lightly like there's an eggshell down there. Yeah.
With the heel.
Uh-huh. And then all the way back up. Good. So keep that big toe jammed down. All of it starts with that hips. Good. So you can even make it a little bit more hip dominant. So hip back, chest forward, almost like you're starting an RDO. Good. And slow down squat from there. Tap, back up. Good. And keep that big toe jammed down.
Yeah, we go on my heel.
Do you feel your glute on your right side?
Yeah.
Yes.
Feel the quad a lot too.
Okay, so make it even more hip dominant, so hips back, chest forward. Now squat down from there. Keep your body weight right in the middle of your foot. You don't want all your weight on your heels.
Okay.
In doing so, with that bigger hip hinge and your weight right in the middle of your foot, you should get a lot more glute engagement. And then here's the deal. You have 20 reps.
Oh yeah.
Okay, so again, your feet don't need to be 100% straightforward, but what I'm looking for is that we're symmetrical. So get have that band just above your knees. Okay, so get into your normal squat stance. I don't want you to be too close. Okay, and just make sure that your feet are symmetrical. Okay, now from right there, here's your cues. You are jamming this big toe down. Okay, and then I want you to open the hips. So screw the feet in. Okay, very good. Now from there, I want you to do a small hinge and hold. Hold it right there. 1, 2, 3, 4, 5. Bring it down a little bit more. Good. Squat down from there. Squat, squat, squat. Hold it. 1, 2, 3, 4, 5. Feel the glutes kicking a little bit. Good. Drop down a little bit more. Drive those hips open, hips open. Good. Keep the toes down. 1, 2, 3, 4, 5. Now go all the way down and slow back up. Very good. Okay, do that whole sequence 2 more times. Okay?
5-second counts.
5-second counts. Okay, so toes jam down, open the hips. Good. Your goal is to feel that glute kicking on and to feel completely balanced in the foot.
Yeah, I think I get a lot of weight on the heels.
A lot of people do, because that common cue, weight on the heels, weight on the heels. Sure, that works fine if you're dipping forward on your toes. But you want to have that entire foot glued down. Big toe, end of the fifth toe right here, and your heel. Tripod foot equally balanced. So basically, because your entire foot is glued to the ground, you should not have weight pushed too far into your heels. If you are, you're just off balance. Find that balance. Exactly. Find that balance. Exactly. When you are finally balanced, you'll unlock potential to lift bigger weight that you never even thought of.
Yeah.
Exactly. Yep. And that's tough for you before
Yeah,
because you were
it's
missing
wonky.
hip intro rotation. You couldn't keep your toe down.
Yeah.
Unless you had to spin your toe out.
Yep.
Right up. Good. Control. 1, 2, 3, 4, 5. Take it down a little bit more. Find your balance point. 2, 3, 4, 5. Good. Control down. Good. Keep the hips open. Feel the glutes.
Yep. It's working.
Yep. Oh yeah.
Triggering crazy.
Yep. And drop all the way down. Good. 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 Yeah. One more, and then we're putting a barbell on your back.
Oh, the glute.
So right there, you can see it goes into a little lumbar flexion. Yeah. Yep. Okay, you can re-rack. We may have to be a little bit more like here, but your goal is to drive that knee over that part.
Okay.
Yep. So hold this. That basically keeps your chest up, and then shift into this. You should feel a good stretch like in that groin.
Do I need to get a little higher?
Yeah. You may have to.
Yep.
Is that a good stretch?
Yep.
Probably on both sides
Yep.
in the groin.
Yeah.
There you go. Okay. 5 deep breaths in that out position. And we'll do
Try to
5.
actively drive out
Yes,
too.
drive out, yeah, open the head. Now, so you would start at like 45 degrees,
Okay.
and then based on where you go, eventually you go complete lateral.
Okay.
Yeah.
Okay. So being able to get laterally out
Is the goal.
is okay. But
Yes.
not super critical to start with.
It's not super critical, no.
Yeah, I guess that's where I just felt these were like I can't even get out there.
Yeah,
So you're really looking for more this bottom leg to be the prime.
sort of. It depends on the person,
Oh, yeah.
and it depends on like where you're actually feeling this at. You'll see some people that, and we'll do this on both sides, where literally you can't shift into that top leg as much.
Oh, yeah.
So,
I feel like it should pretty decent, but it's just like there.
and that's the leg that we were limited a little bit more in the Faber Test
Yeah.
at the start. And again, you can play around with it, open that hip up a little bit more. There you go. And shift to the side.
I feel like rear of the capsule.
Okay. Yep. Bracing, but feet in a symmetrical. Okay. And then open those hips, and then slowly descend. Good. Okay, right foot's just a little bit spun out, just a little
I
bit.
can feel it wanting to go, yeah.
Yep.
I can feel it, the ability to guys go outward on this leg more. So this one feels like it's just like, eh.
And that's the Faber
Yeah.
on the right side, or on the left side. So that's why, yes, the left toe, or the right toe wants to spin out because of the limited hip internal rotation.
Yeah.
The left foot, or the left hip can't open as much because of that Faber. And that's why when we're doing the hip, the weight shift, you can feel the difference. Now that right there looks a lot more symmetrical. How's it feel on the hips?
Feels good on the hips.
Less hip flexor pain?
Yep.
Good. Nice work. Good. One more. How's the back feel?
That's good.
That's good. Nice work. Good job. Back up. Okay. Rack it. A lot better.
Mm-hmm.
Wow. Yeah, we still got a little work to do, but it looks like there's a little bit more rotation available on that side. So, we're on the right track. Cool. There we go. Cool.
All right, so as you can see from the video, the improvements we made just in the hour and a half we were there were crazy phenomenal. You know, I was basically able to go from not being able to go really reach full depth in squat without pain, really asymmetric issues, imbalance from one to the other, to pretty decent looking squats and deadlifts. So I'm really pleased with it. I hope you guys can find some relief if you're dealing with some of the same issues. Throw some comments below if you have questions about our hip rehab problems as well, and I'm glad to help you out.